most training programs train psychiatrists in a hospital setting, right? And so when they graduate, guess what they do? They look for hospital-based jobs, which means then the shortage of psychiatrists will be magnified out in the communities. And so we are training, when we say community-based, that's a critical part here. We're training psychiatrists for the community. And the last point that Dee made, which is huge, is in South Carolina, we have a department for drug, alcohol and other drug services, and then we have the Department of Mental Health. And what about patients who have both conditions, have a chemical addiction and mental illness? They sometimes fall through the cracks. We're bridging that gap. And so that we're really going to be inquiry oriented. We're going to ask questions. We're not going to just do things to do things. We're going to figure out if they really will make a difference. Number two, we're community based. Number three, and I think this is huge, is we're spiritually minded. All right? Now, what does that mean exactly? Well, it means that we understand that humans are more than just a physical being. We also exist spiritually. And that's where our personhood lies. That's part of our relationships. Our relationships are at a spiritual level. It gives our lives meaning and purpose. Why would a field like psychiatry tend to ignore or stay away from spirituality? We are not going to do that. We are definitely going to address that, including potentially the relationship with the transcendent, right? And then the fourth, kind of distinctive, and you've heard this already too, is that we are longitudinally designed. And I just to explain that a little bit, most programs are set up where you do 13 4-week rotations. And you exclusively do one thing for 4 weeks and you move on and do another thing, right? In this program, they spend like 1 day a week doing neurology, 2 days a week, doing primary care, 1 day a week doing consults in the hospital, or emergency psychiatry. And all around Orangeburg, we have Orangeburg, of course, but being kind of central, we have our residents going as far out as like an hour, maybe an hour, 10 minutes from here. So they're in Aiken, they're in Lexington, they are here, they are Greenwood, Berkeley. So you see, part of what's very intentional here is to kind of give experiences at as many mental health centers as possible. We are hoping that if they train there, that they'll be inclined to take positions there after they graduate.